Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Kimberly Setzer, Director of Grief Services with Amorem, formerly Caldwell Hospice and Burke Hospice. Welcome, Kimberly.
Thank you for having me.
You have a very important topic to talk about today.
We do.
You have an upcoming teleconference that focuses on trauma, loss, and grief.
Absolutely.
Tell us a little bit about it.
So in general, this is the work that we do. We work with folks who are approaching end of life, but in our grief services program, we work with folks who are coping with grief and loss. And so we've seen a huge increase in the number of traumatic losses. A lot of that is attributed to COVID, not being able to be with our loved ones when they die, just the increase in mental health needs in our community. And so we really want to take advantage of this opportunity to share general information and then some detailed information about coping with grief, but specifically dealing with trauma.
And for this event, it's a virtual event.
Correct.
So people can do it at their leisure.
Absolutely.
How do they sign up?
So they would call our office and sign up 828-754-0101 and ask to be added to that list. There's also continuing education credits that are available if you are a licensed professional and need that credit.
And who should attend or who should sign up for the virtual session?
Anybody who's interested. So it can be individuals in our community who are coping with loss, who want more information. We know that one of the most effective ways to coping with loss is to get educated about grief and loss. And then, of course, we also want to encourage professionals. So folks who work in healthcare, folks who work in mental health, folks who are counselors, licensed clinical social workers, students who are interested in maybe pursuing a career in a profession that you would work in a helping field. And so we want to open it up to everyone. So the reality is, in this time period of COVID, which continues and changes and evolves daily, we all have experienced loss and change. Some folks have experienced the death of a loved one. Some folks have not, but we've all been grieving, whether it be a death loss or a non-death loss. And it's been difficult for all of us. Everything about our life has been impacted. And so a lot of people are trying to cope and deal with trauma and loss and don't even recognize that. So I will say the time period of COVID has been very difficult for everyone, but one of the positive outcomes is that we are talking about grief and loss and trauma a little more openly in society. And so we are gaining a better understanding of how change, grief, losses, and trauma impact us and how we carry those things. So one thing that I like to share with our clients, whether it be individual counseling clients or whether it be in a group setting, which we're hoping to bring back really soon, everyone who's had a loss is grieving, but everyone who's grieving is not healing. And there's a marked difference in those things. And when we participate in educational opportunities or when we seek out support services or counseling and just support from our natural supports in life, those are all indications that we're putting some action behind the need and we're attempting to heal. And so this is one way that Amorem wants to support our community in healing, is to have the continued opportunity for a teleconference. It's an annual event for us, but we really want to bring the conversation to the table about loss and traumatic loss specifically.
When you talk about traumatic loss, I mean, I have an image in my head of like someone being killed in a car accident. Mm-hmm. Is that the kind of thing you're looking at? Or I'm sure it's broader.
Yeah, absolutely, that qualifies. But it is so much more broad. And we have a new element of trauma, especially in light of COVID. So our rituals of grief, our rituals of saying goodbye, even to patients who've had an extended illness, has been interrupted. So we've not been able to be at the bedside in the same way that we traditionally were with our loved ones as they were approaching end of life, and even those who were dying of natural causes. We've not been able to be present. We've not been able to be supportive. Great example of that is folks who had a loved one who died in the hospital. and they couldn't get in there to see their loved one. They couldn't be with them, physically be present. Folks who have been in long-term care. And so that process has been interrupted, as well as the rituals following grief, like funerals, memorials, receivings, gathering of friends and family. Our natural support process and our ritual process has also been interrupted. And for some folks, that has absolutely been traumatic. And then, of course, our traditional explanation of traumatic grief and loss, folks who die in a car accident, folks who have a sudden death, homicide, suicide. We know our suicide rate has been increased. And then just also witnessing traumatic things or gaining more information about traumatic losses. So what's going on in the Ukraine area, exposure to those things can also bring an element of trauma. So trauma is a broad topic. There's so many things that contribute to that. And just being isolated from our loved ones, if they've not been sick or if we haven't had people on a personal level who have died, but not being able to interact with our family, not being able to interact with our coworkers, not being able to have that routine of life. There's an element of change and trauma there for a lot of people as well.
It's a very broad topic because as you were talking, I was thinking about our first responders who see trauma.
Law enforcement,
military. There's a lot of folks out there who have dealt with trauma and probably could learn from
Absolutely. Folks that work in our ERs, folks who work in ICU, anybody who is in a position to respond in crisis. Absolutely.
And as you were talking, Amorem provides grief counseling, whether the person dies in Amorem's care or, just traumatic death,
Absolutely.
dies in the hospital, whatever. So talk to me a little bit about the services Amorem offers.
Okay. So we have two programs. We have a hospice bereavement program, and that is for family members of hospice patients who died in our care and palliative care patients. And so folks who pass away in our hospice program, we have an entire program set up for reaching out to them, offering support to them. Anybody in that family is eligible. We also have a community bereavement program. And so these are folks who had a death of a non-hospice patient, whether it be a natural death, a sudden unexpected death, and that is open to family and close friends of those individuals. And so right now we're offering individual counseling. We're doing that with continued COVID precautions in our office. We also have a telehealth option. Some folks prefer that. It works well for them. I know I have a couple of folks that I see now who are able to work that into their day a little easier. They can't necessarily leave work to drive, be at the session, and then leave. But we can do a telehealth option there. We are hoping to bring back groups soon, but that's still to be determined at this point because we want to be really intentional to continue to be safe with COVID.
Certainly. Again, this virtual conference, you don't have to do, there is a set time, but you have a long time to do actually watch the conference.
Yeah, it's actually available for almost a year.
So really, anytime you have available, you can sit down and watch the conference.
Absolutely. So if you register through Amorem, you'll be forwarded the virtual link, and then you can factor that into your schedule at a time that's convenient for you.
How long is the virtual session typically?
It's right between an hour to an hour and a half. And there's a study guide that comes along with that. And because you are doing it at your own pace, you can pause it, take notes, you can read, listen, you have some flexibility there. I know a lot of times whenever you're taking in a tremendous amount of information, you just can't write fast enough or you can't take notes fast enough. And so it's really good to be able to re-review that.
Certainly. For people who need CEUs, how do they get that? Because it is a virtual conference and it's not like you can hand them out at the end of the conference.
Right.
How do they go about getting those?
So all of that information is included in the packet that you receive virtually via email, but it's very user-friendly, super easy. You'll have the codes in there, and Amorem provides that at no cost to folks who need the CEUs in the community.
So very good resource, very good learning resource for
Absolutely.
folks. Kimberly, before we end, is there anything we've forgotten to talk about? Anything else we need to cover?
I can't think of anything specific, but just in general, one thing that I've really encouraged people to do is reach out for support and reach out for help. And so one of the things that we heard often during COVID, especially when our numbers were really high and we were kind of in those hotspot phases, is physical distancing. But physical is not social distancing. And so reach out to people. If you're still at high risk for COVID, or you can't be in a group for whatever reason, that's completely understandable. But you can visit with folks outside. We're entering a time and a season where, spring is here. Get outside, get around other folks at a safe place for you. But reach out professionally as well. We're really trying to destigmatize mental health treatment. We really want folks to reach out to professionals. So sometimes one of the services that we provide at Amorem is folks call us just to say, I don't necessarily need grief counseling, but can you help link me with a community resource? So Amorem is community-based, and we want to help connect people to community resources with our community partners. And so even if your need isn't a grief counseling need or a grief support need, we still have a lot of information about community resources. There's community mental health providers. We are seeing an increase in the number of integrated care models. So there's a lot of counseling opportunities at primary care doctors now. And then of course there's folks in private practice or agencies. And so even if you just have those questions, we want you to call us just to be linked with other community resources.
And your phone number at hospice?
828-754-0101.
Is there a deadline for people to sign up for the teleconference?
Yeah, so we need everybody to be registered by May 13th.
Okay, and they can go ahead and start signing up now?
Absolutely, it's open.
All right, between now and May 13th, the teleconference is about trauma, grief, loss, a lot of really good subjects.
Absolutely, good information.
Kimberly, thank you for being here today.
My pleasure. Thank you for having me.
And thank you for watching Caldwell County Today.